Hello, hello everybody. Good evening, everybody. I am Dr. Ahmed Ramadan, one of the laser specialists in Egypt. I am so happy to be with you today, and I am very happy and very proud to be invited by your company to give this lecture today. Today we will talk about the laser application in dentistry, and I will focus in the role of dyed laser in dentistry with using different wavelengths, which it is a new in the laser science now, using dyed laser with different wavelengths to make different applications with different protocols. So we will start our lecture now by the role of dyed laser. There's a problem in the network. You can help me. We should now أنا قفلت. لازم نعمل هايد. قفلت ليه؟ الكاميرا. Good evening, everybody. Good evening, dear colleagues. I am Dr. Ahmed Ramadan from Egypt, one of the laser specialists in Egypt and Middle East. I am so happy to be today with you, and I hope the lecture will be useful for all. And I am happy and so glad to be invited by one of the best laser company in the world, by your company, to give this lecture. And I am so happy and proud to be one of this family. We will talk today about the role of laser in dentistry. Especially, I will talk about the role of dyed laser in dentistry. I will show the role of dyed laser with different wavelengths in the application in the daily dental work. As you know now, the laser technology becomes the most innovative technology now. From my opinion, I think that the laser will be in the next 5 years will be the era of the laser. So it's very important now to learn and study and train about using the laser in a daily practice. I will start my lecture now by definition. What is a laser? The laser is a light. It's a light amplification of stimulated emission of radiation. We make amplification for this light to get a high energy to use it in cutting or vaporization or coagulation. And I will explain this in detail. This is one of the most important diagrams. We see it in all of the laser box, which is the laser wavelengths on the electromagnetic spectrum. The electromagnetic spectrum here have a lot of laser devices or a lot of types of laser. Every type of laser have a number. This number is called a wavelength. It is a DNA of the laser device. This wavelength will be absorbed with a special chemical component inside the tissue called a chromophore. This chromophore, which is responsible for the absorption of the wavelength of the laser. When we see here, we see a lot of type of diode laser. One of them or two of them inside the electromagnetic, the visible area, and others in the invisible area. When we go to another slide, which is more important slides in this lecture, we see a lot of laser types with different wavelengths. We see diode laser with the wavelength 470, which is the best one for making surgery. As we see here, the vertical line, the absorption coefficient, and the horizontal line, the diode laser wavelengths. When we see for the wavelengths of the diode laser, which is the flow laser, it's the new laser, 470, we will see it have a good absorption and higher absorption in the melanin cells and in the hemoglobin cells. We have a higher absorption in melanin and hemoglobin cells, so we use this wavelengths in surgery. It's the master in surgery. We will cut and coagulate without touch, without contact, with minimal amount of power. It's very important using minimal amount of power during surgery. This will reflect about the healing. This will reflect about the pain after surgery. There is no pain after surgery. There is, it will accelerate the wound healing. And you will see here another type of diode laser, 980. It have a good absorption in water and have absorption in hemoglobin and low absorption in the melanin. So we can use it in surgery. Yes, we can use it in surgery. But when we use this wavelengths in surgery, we should increase the power of cutting and make initiation for the delivery system, which is a fiber optic, and make contact to the tissue. This will increase the heat transmitted to the tissue, and this will affect the pain after surgery and affect the healing. So when we compare between the 980 and 470 in surgery, the best of choice is 470 because it have a higher rate of absorption, 10 times in melanin and more than 100 times in hemoglobin. So it will be cut easily without touch, without contact, with minimal amounts of power. So we use the 980 in decontamination of the root canal, in decontamination of the pocket, in decontamination of the bony socket after surgery or before putting the dental implant in the socket. So the master of decontamination here is 980. The master of surgery here is 470. We will see also this diode laser with the wavelength 650. This is the master of the biostimulation and the myomodulation and using in the photodynamic therapy. It have a good absorption in melanin and hemoglobin. We use it with minimal power to make the superficial biostimulation, and I will talk about this in detail, the biostimulation and the mechanism of the biostimulation to the tissue. So when we talk about the diode laser, we will not talk about one wavelength. We will not about more than we will talk about more than wavelengths. So I think I am proud that the Bion company gave us the 3 wavelengths in one device, 470, 650, and 890, 980 nanometer. We can use every wavelength in the suitable position to get the desired effect. Now we will talk about the laser tissue interaction. I mean, when the laser is fell to the target tissue, it may be reflected when there is no chromophore inside the target tissue. If we use the 470 and put it in the glass, it will be reflected. There is no hemoglobin, there is no blood to be absorbed, so it will be reflected. So this interaction, one of the four interaction, and it's very important to know the reflection, and it's very important to know the laser safety. We can use laser and we can use the mirror inside the oral cavity, and the 470, we use it in the surgery, and it will be touch the metal or surface-like metal. It will be reflected, so we should wear the glass, safety glass, and the patient and the operator and the assistants. The another interaction, the tissue may have the chromophore, that will absorb the laser, and the action may be transmitted without any affection in the target tissue, or scattered with poor affection or poor results in the target tissue, and absorb it inside the target tissue and make a good results to the target tissue. When using the laser with low level laser energy, we will make the biostimulation for the tissue. And when you use the light laser with higher level of laser energy, we will make cutting and coagulation and vaporization and ablation and decontamination. Now, we have a question. Why dental laser? Now, why dental laser now? Why we talk about laser now? Why we talk in the previous 5 or 6 years in the dental laser? And I told you at the first in the lecture about the next 5 years, it will be the era of the dental laser, because the psychological acceptance of patients, one of the most important answer for these questions, the psychological acceptance of patient by laser technology, by the laser science. It's very important. Most of people now know what is laser and what is the success and amazing results we can get when we use a dental laser. The second question is no bleeding cuts. It's very important to cut in the bloodlet field and will affect the resolution and vision during work. When I work, when I see well, I will work well and I get the good results. When I use laser, dyed laser in cutting, especially 470, I will cut and coagulate in the same time without cartonization, and I see everything I will do. When cutting done, when the coagulation done, there is no need for take stitch. It's very important. And when we showed the slides, we will see some of patients have the fibroma in the corner of the mouth. If we remove it by scalpel, we need to take stitch in this area, and the scar will be appear, and it's very, it's not good to the patients. Also, when we use the dyed laser, we reduce need for injection of anesthesia, because when we cutting with dyed laser, the heat of dyed laser will make a denaturation for the protein of the nerve ending and making blocking for the nerve ending. So after surgery, there is no pain, because we make a blocking for the nerve ending in this area. So we reduce need for injection of anesthesia, and this provide precise and controlled cuts. If we compare between the laser and electrosurgery, we will cause collateral damage to adjacent tissue. When we're using the laser, there is no collateral damage to adjacent tissue. And when we use the laser, it's painless and less degree of edema, and I will talk in detail about the degree of edema after using the laser surgery. All of this will provide a higher level of patient comfort. We can also make better wound healing. We can accelerate the wound healing. We can accelerate the osseointegration process. We can make a nerve regeneration by using dyed laser. We can make a decontamination and disinfection for the canal and bony socket and pockets by using 980. We can decrease the sensitivity to the hot and cold. It's very important application by using dyed laser, and I will talk about it. So when we use dyed laser, we use minimal invasive and less traumatic applications. Less number of tools. We will reduce the total number of the appointments. We can remove the caries without drilling, and this by the hard tissue, which is selective removal of the caries. So what? After this, it will overcome the dental phobia between us and patient and make the positive chain between the patient and doctor. And this will reflect about the flow inside the clinic, and it's very important for us. Now, we will begin to take about the role of dyed laser in dentistry. I will talk about the biostimulation by using the low-level laser therapy, by using the 650 nanometer, by using this for making the biomodulation of the tissue. And I will talk about the surgery by using the 470 nanometer to make the surgery without contact, without catch, with minimal amount of power. I will talk about the role of laser in pediatric treatment. We have a role of laser in pediatric treatment in pulpotomy and in removal of the operculum and exposure of unerupted teeth. Also, we will talk about the orthodontic treatment and the role of laser in orthodontic treatment and in cosmetic and periodontal and endodontic treatment, and also in implant surgery. Let us talk about the biostimulation using the low-level laser therapy. At the first, what is the best choice wavelength for making the biostimulation? The answer is 650. We use the 650 is it's the master for biostimulation and biomodulation. At the first, if we wanted to accelerate the wound healing, every dentist wants to accelerate the wound healing after surgery, after extraction, after making any surgery, because we have some patients suffering from diabetes, suffering from heart disease. We fear about the post-operative infection and subacute endocarditis. So we need to accelerate the wound healing. If we use the dyed laser with this power, with minimal amounts of power by 650, we will accelerate the wound healing? Yes. How? How we can accelerate the wound healing with using the 650? If we use the 650 nanometer and expose this for the socket, as you see here, by using the biostimulator handpiece, by using the power of 200 milliwatts for 1 minute at least, it will make a relaxation for the smooth muscles in the blood vessels in this area. And it will make relaxation for the smooth muscles, and it will increase the blood flow in this area. This will increase the oxygen and nutrition to the fibroblast cells, which is responsible for the wound contraction, and it's responsible for the wound healing. Also, when we use the 650 in this area for 1 minute by the power of 200 milliwatts, we also increase the basic fibroblast growth factor, and also we increase the secretion and increase the immune function to secrete the cytokine secretion, which will increase the proliferation and the maturation of the fibroblast cells, which is responsible for the wound healing. Also, when we use the biostimulation or low-level laser therapy to this tissue, it will transform the fibroblast to the myofibroblast, which is responsible for the wound contraction after 24 hours. And also, when using the 650 nanometer by the power of 200 milliwatts for 1 minute, it will decrease the secretion of the prostaglandin secretion and interleukin-1, which cause the pain and the redness and swelling. And also, when using the 650 for 1 minute, it will increase the secretion of endorphins, which is a pain attenuation. So after 3 days or 4 days, we will see this picture. We will see the wound contraction. We will see this picture without bleeding, without infection, and the wound accelerated. It's very important, and it's very important for the patients and doctors. Also, we can accelerate the bone deposition and bone remodeling. And it's very important when we putting an implant, we need to accelerate the bone deposition around implant. When we extract, we need to increase the bone deposition and bone remodeling in the bony socket. When we make orthodontic treatment, we need to increase the bone deposition. It's very important application using the diode laser. Also, when we're using 650 for biostimulation, it will make the pain attenuation by decreasing the secretion of the prostaglandin secretion and decreasing the secretion of the interleukin-1 and stimulate the endorphin release, which is a pain attenuation, and it's very important. So when we make the surgery, if we make it by lancet or make it by laser, if we use after surgery the low-level laser therapy, we will never see swelling, redness, edema, and the patient will never feel with pain. Also, we can using the low-level laser therapy to accelerate the restoration of normal neural function after fresh injury by inducing the nerve regeneration. It's very common when we give a nerve block or extract the lower eight, the patient may feel numbness after surgery. This is due to injury to the nerve. If we use the low-level laser therapy after this injury, we will accelerate the restoration of normal neural function after fresh injury. Also, we can use a low-level laser therapy for treatment of sinusitis after the common cold, because it will improve the microcirculation and reduce the edema. As you see, we use the power of low-level laser therapy. We use the red laser. We use the 650 by the power 200 milliwatts for 1 minute in the frontal ear sinus and in the maxillary ear sinus. You see the safety goggle. It's very important. The patient should wear the safety goggle, the doctor and the assistants. Also, we can use the low-level laser therapy in treatment of herpetic lesion, because the laser will improve the immune function and increase the lymphatic flow and the healing enzyme in this area and improve the microcirculation and relieve the pain and swelling and redness in this area and increase the wounds acceleration. You see this case before using the laser and after using the laser. Also, we can use the low-level laser therapy in treatment of gingivitis, because it will increase the microcirculation and the blood flow in this area and the nitration in this area, and will decrease the prostaglandin secretion and the interleukin-1, which causing the redness and swelling and edema. And also it will relieve the pain. Also, we can use the low-level laser therapy in treatment of TMJ pain. I have a special lecture for treatment of TMJ pain by the laser, but I will talk now briefly by the treatment of the symptoms of the TMJ in the treatment by low-level laser therapy. Most of patients suffering from the TMD because some of bony defects and slippage of the disc, it will make the spasm for the muscles of mastications, and the pain, the patient will feel pain during opening. Some of patients come to our clinic with severe spasm. He cannot open his mouth. So we use the laser to make relaxation for the muscle of mastication and reduce the pain in this area. I want to talk about the area we can use the laser in it. In this area, ask the patient to open and close his mouth. Open and close his mouth. You will determine the condyle in this area. This is one of the trigger points. We will use the biostimulator in it. We will have 3 points above, anterior, and posterior to the condyle. Each point, we will expose it to the low-level laser therapy by 650 by the power 200 milliwatts for 1 minute. 1 minute upper to the condyle, 1 minute to the anterior to the condyle, 1 minute to the posterior to the condyle to make the biostimulation for this area, because we're suffering from inflammation in the synovial fluid and this tissue. And we can making the biostimulation intraocular for 1 minute using 650. And also, it's very important for making the biostimulation to make relaxation for the masseter muscles and temporalis muscles. And this is a trigger point anterior to the temporalis muscle, middle temporalis, posterior temporalis. And it's very important to make massage before making the laser therapy here. If we make good examination with the patient before using the low-level laser therapy and putting your hand in this area, we will feel it tender, because there is a very high spasm here in these muscles. So using the laser will make the relaxation for these muscles and will reduce the pain, and the patient will be happy and will open his mouth. We need to make this session more than 1 time till the recovery occurs. Also, we can use the low-level laser therapy to decrease the dental hypersensitivity. Dental hypersensitivity, we have many causes for dental hypersensitivity. It may be due to a recession of the gum, as we see in this picture. It may be due to attrition of the enamel surface. It may be due to cracks. We have a lot of causes for making the hypersensitivity. We can use low-level laser therapy by the 650 nanometer to overcome this hypersensitivity, because the low-level laser therapy will make analgesic effect by make a depression for nerve transmission, by making alteration for the transmission of the nerve in the C fiber. And also we can use fluoride gel or potassium nitrate laser activated gel, which is very important in treatment of the hypersensitivity by using the laser. It will making blocking for the dentinal tubules, and it's very important application with using low-level laser therapy. Also, we can using the low-level laser therapy in the photodynamic therapy, which is chemical dyes absorbed by 650, absorbed by low-level laser therapy. It will make reactive oxygen sepsis, and which destroys the cells. We use it in pockets, and we use it in endodontic treatment, and we'll see the picture after this. Also, we can use the dyed laser in the surgery, and now we will convert to the another wavelength, which is the 470. At the beginning of the lecture, we told we talk about the different wavelengths, and we talk about the 980. We can use surgery by 980, yes, but we will do the surgery by 980 by high power, with touch to the target tissue, with initiation to the fiber, which called hot tip phenomena. We will increase the temperature, which will transmit to the tissue to be removed, and we will transmit this energy and heat to the underlying structure. So the master wavelength for surgery is 470, because we use it without touch, without contact, without initiation, with minimal amounts of power. And it's very important for the soft tissue, which will be removed, and the underlying structure. And it's very, very important. At the beginning of using laser, I make a big problem with using laser. When I using laser to remove the operculum over lower 8, I using the 980 with high power, with continuous mode, and I make bone necrosis for the tissue underlying the operculum. And it's very dangerous, and it's very painful for the patient. This patient also will recommend it for me. Recommendoma. We know recommendoma. Everyone know recommendoma. When we treat relative patients, everything will be no good. We can use laser for fibroma removal by using 470 to removal the fibroma, as you see, without carbonization, without touch, without initiation, as well minimal amount of power. And also, we can use after surgery the biostimulator handpiece with the wavelength 650 to accelerate the wound healing and to release or to decrease the pain and to increase the microcirculation, to increase the proliferation and of the fibroblast cells and accelerate the wound healing after surgery. We see here fibroma in the corner of the mouth. If we don't have laser and make it by scalpel, we will see bleeding, and we will need to take stitch in this area. And taking stitch in this area will making scar for the patient. So we will use the laser with minimal amount of power by 470 and remove this fibroma, and the wound healing will be after 3 days, very fast, and seems very good. Also, we have hair fibroma in the lip. You can imagine if we use a lancet or scalpel to remove the fibroma in the lower lip. If we use a scalpel to remove this fibroma, we will not see anything. We will see blood only. But if we use a laser, we will cut and coagulate in the same time. So it's very important for patient, and it's very good for patient. And we can use biostimulator after making the surgery to accelerate the wound healing and decrease the pain also. See here, fibroma in the tip of the tongue. We use the 470 to remove it after 3 or 4 days from the healing. Also another case, we see the good removal for the soft tissue. We should transfer the soft tissue to the pathological lab to know what is this. Also removal of the epilis. Here we use the 980. This case I use the 980. And this case we use 980 for the gingival hyperplasia and epilis and removal of the pyogenic granuloma. We see the carbonization because we use the 980 with high temperature, with touch to the tissue, with initiation to the fiber tip. Also, we can use dyed laser and treatment the pain of the abscess ulcer by using 470 to making the blocking for the dentinal tubules around the abscess ulcer and make relief for the patient's pain, and use the biostimulation after that to accelerate the healing of the abscess ulcer. After using the laser, we should see the abscess ulcer chalky white appearance. We will make the denaturation for the blood supply in this area and the denaturation for the nerve ending in this area, and it will be seen chalky white appearance. We will use it. We can make it by 980 and 470. If we use it by 980, we will use 2 watts continuous mode, non-touch, also non-touch in this case. And if we use 470, we will take the power of 1 watt continuous wave. Hemangioma also can be treated by using the dyed laser. We will make the protein denaturation for the blood vessels with using the laser, no touch, and without using anesthesia. It's very important. We will make the denaturation for the blood vessels, for protein in the blood vessels, and we will make the coagulation for these blood vessels, and we leave it and to be scarred. It will be at the first time chalky white appearance also, as you see here. Here it will be scarred after 2 weeks from the treatment. Also, we can use a laser after episectomy to decontaminate the bony socket, to killing all of the microorganisms. Using the 980, it's the master of decontamination of the laser, of the dyed laser. We can use it. We make swapping motion inside the bony socket after making the curettage, after making the irrigation. We use the laser at the end of the surgery to make the complete decontamination for the bony socket, and we can use it to softening the cataperca, to putting the retrograde filling, as you see. We can use the laser in the areas it's very difficult to be used by the hand instruments, as you see between the two roots here. Also, we can use the laser for removal of the denture fasciatum by using the 470 with minimal amount of power. Using the dyed laser in the periodontal treatment is very important for us. Most of patients suffering from pockets and suffering from bad restorations and suffering from bad oral hygiene measures, a lot of patients have pockets in his mouth, and it will be very painful, and all of the patients suffering from bleeding and pain in this area. We can make the curettage and irrigation then with decontamination by using dyed laser. We use the dyed laser with 980, the master field for decontamination, for making the curettage and remove the granulation tissue, which stuck to the superficial epithelial layer, which prevents the healing to be done. And after making the curettage, we can use the biostimulator handpiece and making biostimulation superficially to accelerate the wound healing here and to decrease the pain. Also, we can use the laser in the cosmetic treatments. One of the most important applications for using the dyed laser is for making gingivectomy. We see here after making or during making orthodontic treatment, the patient suffering from the bad oral hygiene, and the gingival will be inflamed and it will suffer from gingival hyperplasia, as you see. We can make gingivectomy with using the master wavelength 470 blue laser for cutting the soft tissue with minimal amount of power, without using a periodontal pack, without bleeding, with minimal amounts of power. As you see here, there is gingival hyperplasia and the interdental papillae more edematous and the tissue more fibrous. If we use a scalpel here and remove one shot from the soft tissue, we will never see anything after that because we have excessive bleeding. So using laser here, it's a magic treatment for making the gingivectomy for patients and for doctor also. We can use biostimulator after making surgery to accelerate the wound healing. As you see, after 3 days, it's very good. After 15 days, we will never see anything. Also, we can use the dyed laser for making crown lengthening. For making crown lengthening, in this case, we have caries, class 4 caries, class 5 caries, and we need to prepare our cavity under the soft tissue. If we don't have laser, we will remove the soft tissue by the lancet or by scalpel, and we will wait for 5 or 6 days waiting for the complete healing to prepare the cavity and putting the composite. If we have a laser, we will cut and coagulate in the same time and prepare the cavity and putting the composite in the same visits. And it's very important for the patients and for the doctor also. You will see the fiber optic, it will be 45 degrees towards the soft tissue, not 90 degrees. It will be 45 degrees for the soft tissue. And here we will use the 980, and it's better to use the 470. Another case, we need to make crown lengthening and removal some of soft tissue to have the grip to build up this tooth and putting the post and making the impression to get the crown for the patients. We here using the 470, so there is no carbonization here. There is no inflammation. As you see in the previous slide, there is carbonization here, and there is some of swelling and a little bit of bleeding. Here, after surgery, there is no carbonization because we use 470. Also here, we use 980 in the crown lengthening, and you show the difference. You show the carbonization here. You see some of inflammation of the soft tissue because we use laser with high parameter, with high power, and this will affect the after surgery healing time. The period of healing will be affected, and the pain, it will be more than using 470. Also, one of the most important application for using the dyed laser before getting the impression is troughing. Troughing by dyed laser is amazing. We can appear the sublingual finish line by using the dyed laser and stopping the bleeding and take the very good impression showing the subgingival finish line for me and for the lab to get the perfect margin and perfect restoration as you see. Another case you see before using the laser, we make a troughing. We see now the subgingival finish line. Okay, we can take good impression and send it to the lab. It will be very happy. Also, one of the most important application for dyed laser is the gingival depigmentation, and it's very important application for us in Arab country, especially in Saudi Arabia and the Emirates. More females have depigmentation, gingival depigmentation. We have a lot of causes for gingival depigmentation. It may be due to bad habits as smoking or drinking wines. It may be genetic racial depigmentation. We need to remove the superficial layer which has the melanin cells by using the laser by the peeling action. We use 470, and power will be minimal amounts of power. We can use the depigmentation, we can use 0.6 watts by pulsating mode with 470. If we use 980, I will take the power 1.5 watts, 1.5 watts. It will be more than the 470. So we use the 470 for making peeling action for the melanin cells here to get the good results as you see. In this case, we make 4 applications. We make a bleaching, we make a depigmentation for upper and lower arch, we make a crown lengthening for the lower central incisor and take the impression, and we make also 2 veneers, ceramic veneers to close the diastema here. This will be done in 2 visits. By using laser, you will reduce the total appointments for the patient, and it is good for you and for your patients. Another case, we use the 470 to making the gingival depigmentation after surgery. After 1 day of the surgery, it is amazing. There is no pain because we use the laser with minimal amount of power. After 3 days of the surgery, we see complete healing. Another case, before making depigmentation and just after making the depigmentation with using 470. We can also making the lip depigmentation, and it's very critical application. We need a best and well trialed doctor to make the lip depigmentation before the lip tissue is very sensitive. Here we will make the lip depigmentation using 980, and this is the results. More inflammation and redness and more pain because we use high power for making the peeling action for the superficial layer of the lip. This is after 3 weeks from the healing. We should told your patient that the lip depigmentation is different from the gingival depigmentation in the period of healing. The gingival depigmentation, we will take 3 or 4 days for complete healing. But for the lip depigmentation, because it's very sensitive tissue, we will take about 2 weeks or 3 weeks to get the full wounds healing. And we will give the patient some of corticosteroids creams and some medication to decrease the pain and swelling after surgery. In this case, we use the 470. There is a great difference between the 2 cases. 470 with low amount of power, we can use it by 0.4 watts for making the peeling action for the lip tissue, and this is the results. It's amazing and good results after 2 weeks because we use low power and low parameter. Also, one of the most important application in laser and in dentistry is the bleaching. When we compare between the bleaching by using LED light and we compare the using laser light, it's a great difference for the doctor and the patient, because when using the LED light, also almost the patient have pain after this application, because it will have the sensitivity to the hot and cold, and sometimes it will feel the electricity pain in some tooth because we concentrate a lot of heat to the tooth for a long period. When we use laser in bleaching, we concentrate the laser for short period, 30 minutes for activation of bleaching gel for each quadrant, 30 minutes for each quadrant, then leave the bleaching gel for 5 or 10 minutes, and we can repeat the application by using laser. Now we can make the bleaching by using the blue laser. As you see now, using the blue laser with any type of bleaching gel, you will have amazing results as you see now in these slides. Without pain after application, without any affection of the enamel surface of the tooth. Another applications for diode laser in the pediatric treatment, we use the soft diode laser for exposure of unerupted teeth. As you see, the upper central incisor, we have a lot of soft tissue, preventing the eruption of the central incisor. We're using the 470 for removal of this soft tissue and for allowing the central incisor to be erupted with minimal amounts of pain after surgery, and we can make it without taking anesthesia. Just only we will put topical anesthesia and we will make our surgery by the 470 with minimal amounts of power. We can use the power 0.7 watts without initiation, without touching, to remove this soft tissue to allow the central to be erupted. Also, we can use the laser for removal the operculum. This is lower 6 molar begin to erupt, and we have operculum soft tissue covering the lower molar. It's very painful for during talking and during eating. So we can remove it by using the dyed laser with minimal amount of power, without no pain after surgery, without bleeding during removal. Another case, we can use it for removal of soft tissue to expose the upper canine, and we can use the laser in the pulpotomy. It's very important using the laser in the pulpotomy. In this case, we will use the 980 by the power 1.2 continuous modes watts for decontamination the cavity, and the making stopping and disinfection for the cavity, and making stopping for the bleeding, and putting the final restoration in the same visit. It's a very important and amazing application by using dyed laser. Also, we can use the dyed laser in orthodontic treatment. We see here the brackets and wires. It may cause the traumatic abscess ulcer, and we can manage it by using dyed laser, as we told before. Also, we can make exposure for unerupted tooth to putting the braces in the same visit, because when we expose the laser, when we expose the soft tissue by using the laser, there is no bleeding. We can put the braces and making bonding for the braces in the same visit and complete our orthodontic treatment. Also, this will decrease the total appointments for the patient inside the clinic, and it's very important for us. Also, we can accelerate the tooth movement by accelerating the osseointegration, and also we can reduce the pain after the orthodontic treatment by decreasing the prostaglandin secretion and the interleukin-1. As when we moving the tooth, there is tension in the periodontal ligament will be occur, so it will increase the prostaglandin secretion and the interleukin-1 secretion. It will very painful for the patient, and when we use the low-level laser therapy by 650 nanometer, we will decrease the secretion of the prostaglandin and interleukin-1, and will increase the endorphin release, which is a pain attenuation, and the patient will be happy in this application after treatment. Also, we can use the dyed laser in endodontic treatment for decontamination of the root canal. In this case, we will use the fiber optic with diameter 200 micron. In the surgery, in using dyed laser in the surgery, the delivery system will be the fiber optic with diameter 400 micron. In the endodontic treatment, we will use the another fiber optic with less diameter, 200 micron, to be flexible and to be easy to be reach to the apex of the roots. We can use also here photodynamic therapy, the photodynamic dyes, which will be absorbed by specific wavelengths at 650 to make the decontamination of the root canal. One of the most important application using the dyed laser is the decontamination of the endodontic treatment to increase the success rate for the endodontic treatment, because the laser will kill all of the microorganisms inside the root canal, and also can overcome the vital pulp in lateral auxiliary canals, and also we can treat the periapical pathosis below the apex of the root, and also we can treat the inflammation of the periodontal ligament after mechanical preparation. We should use irrigant solution like citric acid. It's the most and it is a bitter irrigant solution. We can use it with the dyed laser. The last application we will talk it about this lecture is the role of dyed laser in implants. It's very important to using the dyed laser in implant. From the first stage to expose the soft tissue for beginning the implant procedure, we can remove the soft tissue without using tissue punish. If using tissue punish, we will make the flap by scalpel. We will have a lot of bleeding and the vision will be difficult. If we use the laser to expose the soft tissue, we will remove this soft tissue without bleeding, without touch, without pain. And we can use the dyed laser in the second stage to expose the covering screw to putting the healing abutment here without bleeding. And we can make also the contouring for this area for taking good impression. And also we can use the dyed laser in the cases of immediate removal of infected wounds and putting immediate implant. We need to make decontamination and disinfection for the bony socket. We use the laser in this application to decontaminate, to killing all of the bacteria and putting our implant in very decontaminated area. As you see here, this fractured tooth, we should remove it. After removal, we can make decontamination for the bony socket to putting our implant in a sterile area. Also, we can use the low-level laser therapy to increase or to accelerate the wound healing, or to accelerate the osseointegration process, and to increase the bone remodeling and bone deposition after putting the implant, and to decrease the pain after surgery, and to decrease the swelling and edema and redness and swelling after surgery. It's very important to using laser by low-level laser therapy after surgery. Also, we can have peri-implantitis cases. In the previous cases, we use the titanium brush to clean the implant surface, and this will affect the implant surface and the surface treatment of the implant. Now we can make the decontamination for the implant surface by using dyed laser, and in these cases we will use the 980 for making the decontamination, and also the 980 will not affect the surface treatment of the implant. It's amazing for decontamination, the implant surface and the area of soft tissue, for putting another or new bone graft and making biostimulation after this for increase the bone deposition and increase or accelerate the wound healing. Another case for exposing the implants in the second stage, as you see here, without using the tissue punish, without using the scalpel, with no bleeding, with no inflammation, with minimal amount of power, without anesthesia. It's very important for patient to make the procedure without anesthesia. And all of them will done in the one visit, and we can take the impression in the same visit, and it's very important for the patient. As you see here, we make the exposure and for the covering screw, and putting the healing abutment or putting the temporary restoration, and making contouring to take the final impression for the restoration. This some picture from our courses in Egypt and in the Middle East. Now I finished my lecture, and I am so happy to be with you today, and I am very proud to be one of the family of the Bayonne company. I hope the lecture to be useful for the all, and we can contact in WhatsApp in this number, or by using the Gmail. I am very happy to be with you today. As you see, the laser in the next 5 days will be It's very important, and I think it will be the era of the laser. So we should learning laser well. We should learning laser physics. We should learning the laser tissue interaction. We should know everything about laser physics. We should know everything about laser tissue interaction and how the laser work in all of the applications. We will try to make another lectures and we will focus on specific items, laser physics, laser tissue interaction, laser safety, and applications of dyed laser by more details and by more videos and by more pictures. I am very happy today and I am ready to hear any questions or to hear the feedback about the lecture. Thank you for all and see you again. Thank you. Hello, everybody. We have two questions now. One of them about which agent would you recommend about the BTD. I recommend the toluidine blue or methylene blue with the wavelength of 650. The second question about if we can use bleaching for laser, the same bleaching laser is the same for biostimulation. The answer is not. The best choice for biostimulation is 650, and if we use 980, it may be used for biostimulation, but the 650 is more better than 980. But we use now for bleaching by laser 420. We give us the amazing results. Any question? Other questions? Okay. I am so happy to be with you today. Uh, the picture not seen. في something بتقول لي الصوت مش واضح. Okay. The voice is good now. Yeah. We have two questions now about the recommended agents for the BTD. I recommend the toluidine blue or methylene blue when we're using the 650. The second question about if the bleaching laser is the same, the laser for biostimulation, the answer is not. We use for biostimulation the 650. It's the best of choice for the biostimulation and the biomodulation, while we use for bleaching one of two wavelengths, 980 and 470, and I prefer and recommend the 470. Any questions? I am so happy to be with you today. I hope the lecture will be useful for all and see you again. Thank you very much. Thank you.